Yeah, it's Coronation Park, I think.
16 years old, a son, an older brother, and loyal friend. Finlay Van der Werken's life is now a collection of memories closely guarded by his parents.
I still hear his laughter. We do what we can to keep his memory alive, but we miss him so much.
In early February of 2024, a migraine kept Finlay home from school, but his condition got worse.
He was crying out in pain a lot. He didn't know what was going on, but he knew it was not normal. So I drove as fast as I could.
Hazel took her son to Oakville Trafalgar Memorial Hospital just outside of Toronto. She says he would not see a doctor for hours despite telling the nurses Finlay was not doing well.
When I went up at 3 in the morning, they said, well, we only have one doctor, but there's another one coming in at 4. I don't know where that one doctor was.
Finlay was triaged at almost exactly 10 o'clock, and he wasn't actually seen by a physician until 6:22 in the morning.
According to the statement of claim about what happened that morning, the doctor said Finlay was experiencing sepsis pneumonia with hypoxia, and he was at high risk for acute deterioration. His oxygen levels, which hospital records show had been dropping throughout the night, were a concern.
I remember just saying to Finlay, like, Finlay, we got to get, we're looking at this screen that's got his oxygen saturation. I'm like, we have to get it up. And his breathing was so shallow by this point. And he said, I can't do deep breaths. It hurts too much. I said, you gotta try.
Finlay eventually needed to be intubated and also suffered a cardiac arrest. Finlay was taken to Sick Kids Hospital in Toronto, but it was too late, as he was then in hypotensive shock.
We had to make the decision to take Finlay off life support.
Or risk that the situation would escalate even more and he would wake up and die in a lot of pain.
After Finlay died, hospital staff did meet with the family to review what happened. In a written statement, officials said, like many hospitals, we are seeing more patients presenting with increasingly complex health conditions and comorbidities. This places significant demand on our emergency departments, patient flow, bed availability, and the patient experience. The family has since launched a lawsuit alleging in part the healthcare team failed to monitor Finlay, have appropriate protocols in place for his treatment, or inform the family of the true nature of his condition.
The experts are quite clear and unequivocal that this was a treatable condition, and had he been treated promptly, there is no doubt in my mind that he would still be here today. He was triaged as a second highest level in triage, and the guidelines say that 95% of the time they should be seen within 15 minutes.
The hospital says they are making changes to track data more closely, refining their on-call coverage criteria protocols, and implementing other tools and working groups to improve patient flow and communication. But the family wants more awareness so something like this never happens again.
But we feel that we have been let down and we cannot trust the medical system as it is right now.
Katherine Ward, Global News.